Welcome to day 2 of the National Press Foundation's Covering Equitable Community Development journalism training. We're spending a few days in Missoula, Montana at the University of Montana's Journalism School. And we'll be exploring the issues and initiatives that have developed in recent years in Missoula and in this region to address some urgent development and equity issues for residents. Now, throughout today, we will be exploring health equity, access to stable housing, childcare, community-level financing, and so much more. But before we get started, I would like to take this opportunity to thank our sponsor, the Robert Wood Johnson Foundation, for their support of NPR's mission to strengthen the expertise of local journalists. So for this first session of day 2, we're going to be learning about the Missoula Invest Health Initiative. Now, Missoula is one of 50 mid-sized cities across the country that the Invest Health project operates on. And it brings together partners from health and well-being sectors throughout various communities. Invest Health was developed to provide an opportunity for mid-sized cities to transform the way local leaders think about creating solution-driven partnerships. We think it was important for many of you who come from larger cities, Chicago's, the Pittsburghs, et cetera, to come to a location like Missoula because it will expand your way of thinking about what's possible in your communities in terms of collaboration, in terms of melding policy with real life urgent issues. And so we're privileged to be hearing from 3 central partners in the Missoula Invest Health project. First, we'll hear from Lisa Beskowitz. She is the Health Promotion Manager and Missoula Invest Health Team Leader at the Missoula Public Health Department. She spent the last 25 years in a leadership capacity, working to address prevention strategies and health disparities. And she oversees the population health programs in chronic disease, substance use, relationship violence, behavioral health, and injury prevention. Next to Lisa, we have Missoula City Council member Mike Nugent, who represents Ward 4. He is also the chair of the Land Use and Planning Committee, and he serves on the Missoula City County Board of Health. Prior to serving on the council, Mike was a commissioner on the Missoula Housing Authority Board of Directors, participating in their mission to provide quality housing solutions for low and middle income households in Missoula. And finally, and this is someone that Mike says is really the heart of this whole panel, so I don't want to hype you up too much, but I think I already did. Ashley Britton-Wells is a community engagement specialist with the city of Missoula. She's originally from East Missoula, and she brings 2 decades of experience in community building, program development, and events. And so, again, you'll see that I think from this presentation, modeling what's possible when it comes to a city, county, state, taking stock of the problem and doing whatever it takes to bring the partnerships together to address problems. So I'm excited to hear from the Missoula Invest Health team, and I'm sure you will be too. So Lisa, why don't you get us started off?
Wonderful. Thank you, Rachel. Okay, so today, this is our agenda for the next hour with you all. I'm going to talk about the Missoula Invest Health background. We're going to pass it off to Mike to talk about the City of Missoula land use and planning, and then Ashley will talk about community engagement for our Missoula project. And then we're going to wrap it up with a couple ideas. We're going to plant some seeds before we open it up to you all for a Q&A session. So as we're talking, if you have questions pop up, please write them down. We will have an opportunity to have questions at the end, okay? So this is our beautiful Missoula community right here. And I saw that you got kicked off last night with Dr. Willie Underwood. So he probably really grounded you in health equity last night, which I'm so excited and wish I could have been a little fly on the wall to hear his presentation. So I'm really honored to be here today and wanted to let you know that we have been thinking about equity community development in our community for like a decade now, deeply. So we are a part of this learning network of cities that Rachel mentioned, the Missoula Invest Health Cities. I wanted to share this with you just to see the diversity of cities that are engaged in this initiative. These are mid-sized cities. So a mid-sized city is defined 60,000 to 300,000. And 60,000 being a small mid-sized city with like Missoula, Montana, where I think it's 75,000 now. And then next to us, our neighbors in Washington, Spokane, Washington, is 300 plus now. And this initiative got us started in 2016. And I want you to visualize all these little red dots as some type of flower. And then I really feel strongly about our networking with all these mid-sized cities over the years as planting seeds and growing flowers around health equity and equitable development with shared learnings across our sectors. And really the foundation of Missoula or Invest Health is really centered not only in community development and health, and here's a little circle right here that represents this. And if you really look at it, it's people are born with different opportunities in life. And so how they come out into the world and start engaging is really dependent on where they live. And I'm sure you've heard the saying that your health is defined by your zip code, but it's also just defined about where you were born and in what socioeconomic income status that you have. And so it's really important that with health equity, knowing that everybody comes out in life, that we have these opportunities to engage in stable and affordable quality housing, access to medical care, healthy food, quality schools, safe parks and good sidewalks to walk on and play with, and having community centers to really gather and have that social networking. And really this initiative, when we applied for this grant, there were more than 50 that applied, so I felt really honored that Missoula was selected as one of the 50. They really started to open up that conversation around community development and health and what does that look like and how they are so interconnected and defined, and making sure that we are providing resources in all of these areas for people. So here's our little team here. This is our team. So when we applied for this grant in 2016, the grant application was actually very simple, which I loved. It was like 4 pages, so it beat any federal grant I had ever written, so I was excited about that. Our health officer, Ellen Leahy at the time, said, Lisa, go for it. Let's do this. Let's break down those cylinders of excellence, as Susan Hay-Patrick, my colleague, right up there in the hat says, let's start being collaborative and start working together on these health equity issues that we see across our communities. So in order to apply for the application, we had to bring in health, which you see Providence St. Pat's Hospital, which is a nonprofit hospital here in Missoula, Montana. Public health, United Way is the center of a lot of our social service, a collective impact model, and really connected with our business sector. And then NeighborWorks Montana and North Missoula Community Development Corporation, they are CDFIs, Community Development Financing Investment. And so they're really the economics around understanding how we can do the financing to make sure that the resources go to the people that need it the most, especially with housing. And so in our application, so this is us back in the day, that's in 2016, doing a neighborhood walkabout that I'll talk more about later. And then here is our little team at our housing convening recent. So I just want to point that out, 2016, 2024, and we still have our original team members. and we made it through the COVID crisis. I just really want to say that out loud, that I'm really proud of our team and our community, that we continue to take strides and steps forward together and are really committed to this process. So really, with what Missoula Invest Health does is we align with the Invest Health principles, where we are trying to apply the community development and health principles in our city. So number one is the health equity. So we focus on our low income, low wealth neighborhoods. And then also we look at accelerating improvements in the neighborhoods facing the biggest barriers to better health. And then resident driven, and this is what Ashley does so well, and we've had different projects and experiences with this, working with the residents as leaders in their neighborhoods, because they are really the experts of what works for health within their neighborhood settings. And then also partnerships are critical to success, and then we are always looking to bring diverse leaders to the table to learn together and to listen to understand what is happening. And then we really are looking to transform the way local leaders work together by having really open, inclusive meetings and trying to communicate through all of our communication channels, our media, our websites, really letting people know what is happening in our community, and then really looking for solutions. So low-hanging fruit, small solutions, to larger solutions. So like a small solution might be, well, small but big, setting up some food pantries in neighborhoods so people can have access to food within a neighborhood without having to cross busy streets to get to the major food bank. So an access to food in that way, or a bigger one, investment in sidewalks where there's missing sidewalks. Effective community systems and assets, we're really looking to increase and leverage private and public investments to the people that need it the most. So I'm going to start really quick with just a little story and how we started in 2016 and how really the seed was planted in our application and in our understanding. So we looked at 3 of our low wealth neighborhoods, River Road, Franklin and Fort, and Northside, Westside. And what makes it a low income neighborhood is that we have more generational poverty in those neighborhoods. And generational poverty is where there is 30 years of people in poverty in that neighborhood. And they had significantly higher generational poverty in those neighborhoods, as well as higher cost burden. So we're for renters and homeowners, meaning that over 30% of their income was going towards housing. And so with that, we saw that there were higher health disparities in those neighborhoods around obesity, with adults and children, poor mental health, and then adults with asthma. So that was our call to action, that we saw there was a health disparity in these 3 neighborhoods. And so we were like, well, we need to go talk to the residents and see what they want and what they need. Okay, so in this journey, we were able to put together a map. I love GIS mapping. I really have learned if you can tell a story through a map, what's happening in your neighborhoods, that people are more likely to have compassion and understanding and more action to be a change agent in fixing the problem. So what I want to share with you is that in this map, I worked with our Missoula County GIS manager, Mike Snook, and we took our data points, and he helped me to layer them, and also our Missoula Metropolitan Planning System, Aaron Wilson, to get our transportation data. But we layered all of our community development data with our health data. And what I want to share with you is that in this map here, the green is where we have sidewalks, the red is where we have missing sidewalks, and then where it says Franklin to Fort, River Road, Northside, Westside neighborhoods, you see those neighborhoods? And where they're brown, that represents the poverty levels. And as you can see, we have more missing sidewalks in those neighborhoods, right? So we have poor health outcomes. Now we have missing sidewalks. And we need, connectivity with sidewalks to get to the parks, to get to the stores, to get to the schools. It's when you don't have to think about it and you can move, the more likely you are to move for better health. Then we engaged the residents. We went to neighborhood council meetings for over a year, talking to neighborhood residents about what was important for their health. And then we did a survey amongst all of the 3 neighborhoods. And sorry, this is cut off. It went from PowerPoint to Google Slides and things jumped off, it looks like. But you can see the number one answer that everybody wanted to better support their physical activity and mental health was complete sidewalks, which honestly we were kind of surprised about because we had never done this before. So we really had no expectations, we had no assumptions, we were just curious. And so that led us on a journey to say, hey, what can we do to get sidewalks in these neighborhoods? So little Lisa from the health department knocks on the city's door and say, how can we build some more sidewalks? Look, this is what the rest of the residents want. And they were like, Lisa, that costs a lot of money. I'm like, well, let's apply for a grant, right? And then at that time, it was 2018, we had an opportunity to apply for a community development block grant. And we did. And so this was the first time in a grant application that we shared our health data with the resident voice of what our residents wanted, the survey results, and then what was needed for better health, which were the complete sidewalks. And then we worked with our transportation division to define what would be the best investment to meet people in the neighborhood. And we found out there was a multi-unit family housing unit on one side of the west side that really didn't have a good sidewalk to get the kids to school. And so that was 1 mile of sidewalk. So we honed in on that, and ta-da, we got the money. So this is the timeline, and so it went really fast and it was really magical, and I was really proud of our application. I was really excited to partner with the city. This was our first time of investing in health, literally. And what I think is really cool too is that that $820,000 is actually 2 pots of money. One pot of money was from the CDBG grant, which was I think like $500,000. And then the other $320,000 came from the city of Missoula and came from our mayor. And we needed a little bit more money to get up to this close to $1 million. And so we asked the mayor if he would match this grant with his sidewalk fund. And he said yes. So that was like the first time that we saw a shift in like a policy and a resource from a public entity come into the sidewalks for the people that needed it. And it was really interesting because when we did the community outreach for this and we went into the community center, the Burn Street Bistro at the west side to share this story with people in the neighborhood, some people were happy, half the people were mad, the other people were confused. And we just had this really great conversation to try to help them understand why a sidewalk is important. People were afraid that if a sidewalk came up closer to their house, that people would break into their house, for example. Somebody had planted, their animals that had passed away on the boulevard where the sidewalk goes, so there was a lot of grieving happening. There was some anger, there was some confusion, but just having that conversation. And Ashley's going to talk more about engaging with residents, but I really learned a lot and they learned a lot. And I'll never forget one lady came up to me afterwards and said, I really didn't like you when you came in and told me you were putting in a sidewalk right in front of my house, but now I get it, and I really do want to help the kids and the people that, are in wheelchairs, and it'll be good for everybody. And so took the I out of the conversation and brought in the we, but we have to create spaces like community centers and having the data to just have the conversation. So that was our big success. So now I'm going to jump. We've gone through all of these journeys with Invest Health. I could talk an hour on Invest Health and all of our projects, but I'm going to move to Invest Health 4.0. But I do want to point out that Missoula has been in all of these parts of Invest Health, 1.1, 2, 3, and 4. And something significant happened in number 2, where we received $75,000, we used that money in our community to hire a coordinator for health equity out of the health department to start to spread the knowledge and the understanding of what health equity is. And now, today, we have, I think, like 3 or 4 equity coordinators throughout city and county government, which is amazing. And I'm so excited and proud of that work. So I'm going to bring us up to Connecting the Field, which is Invest Health 4.0, and we're in 2024. So Missoula just got a small travel grant for a collaboration that I'm really proud of, and just wanted to bring us back to, these are a couple other collaborations that I was a part of, and things are cutting off, but that's okay. You get the gist. The rebuilding and sustaining cross-sector collaboration. This is what is so amazing about Invest Health and all of these 1.0 to 4.0 is that now we have friends across the nation, just like you all are here across the nation. I would encourage you to have conversations with your neighbor and connect, because now you have a shared common thread about a learning experience. And so really, with this journey of Invest Health, that we've really had cross-sector coalitions, and that's where the diversity of having health or housing or some other community development entity or a financing committee or entity like CDFIs have conversations about what's working in your community and what's not. And that really can really seed and flower that garden that I was talking about earlier across our nation. I just got a call yesterday, and in Napa, California, they're looking at building or doing a co-op model for a mom and pop landlord. This is a co-op housing model for a mom and pop landlords that are just done, they're retiring, and they don't want to sell their homes to the highest bidder. They want to keep their residents that are there. So now they're learning about what Missoula did at their housing convening about how to do a co-op model for housing. So that's an example of a coalition, and then the cross-city collaboration. We continue to have these conversations and leverage our small grants for big impacts. So we hosted, here's our little team. This was just a few weeks ago. These are actually 2 pictures. This is the team that was here in Missoula at the beginning of September. 12 cities, mid-sized cities across the nation were here visiting with us to learn about the full spectrum of housing for all Missoulians that I think Mike's going to talk about. And everybody was and is in various stages of housing for all efforts. And really those continue to be planted in our Invest Health principles, and really wanting to make sure that we have equitable and quality housing solutions that are complex across all the sectors. And usually they are capital intensive. I've learned more about finance stacking than I ever thought I would. And this is just an action. Actually, these 2 ladies were on the bus talking to us about our housing, about their housing, resident-owned communities, sharing their story. We're looking at another resident-owned community up there. Down here, we're visiting our temporary safe outdoor shelter with the leadership there. And then this is another model that we were actually walking around doing a code zoning reform tour with Pro Housing Solutions. So we did all of these things last month and really had a lot of opportunity to share what we're doing here in Missoula to provide housing for all and learning from our other cities at the same time. And so in closing, I just wanted to just say that we're always thinking about the alignment of our resources and policies, and that positive change is really what we're focused on every day when we do this work. And we are really looking to advance that through community development in every little, medium, and big way that we can, wherever there's an opportunity. And when you share the knowledge, that opens up the conversation for partnership and collaboration. And then we provide peer support to catalyze and sustain this work. And that's where I think it's just really great that, we're here and that, Mike and Ashley and I work together. And, it's just, I think you can do that in a mid-sized city, and especially in Missoula, Montana. Feels really good. So that is it for me. And I'm going to pass it on to Mike now. Now let me-
All right. Good morning, everybody. Pleasure to be here. Rachel told you a little bit about my background. Obviously, I chair land use and planning. I'm really excited to be doing this presentation with both Lisa and Ashley, but especially Ashley and I kind of will tell you different pieces of the same puzzle and how it kind of works together at the City of Missoula. I'll give a little bit more of the why and the kind of political environment of how we got here and some of the realities of what's going on in Missoula and in Montana. And then Ashley's going to tell you a little bit more about the how we're going to achieve this. But the Our Missoula project is essentially a complete code reform project in the City of Missoula to make housing and development more equitable across the housing spectrum. So that's everything from subsidized housing all the way through market rate housing, because in a lot of ways they relate together. And truth be told, when stories are told about housing, often it gets too focused on the one specific, but it kind of doesn't pull back and look at how this all interacts together and how a investment in affordable housing helps the non-subsidized market just as much as it does the people needing housing. So there's kind of that bigger picture there, and hopefully we kind of will share that. A little bit more about my background. In addition to serving on the City Council, and then previously I was commissioner on the Missoula Housing Authority, which deals with permanently affordable housing, Section 8 housing, things like that. I also do work in the private housing world. I'm the vice president of Berkshire Hathaway across Montana, which is a real estate brokerage. And because the CEO of the Missoula County United Way is in the room, I need to tell you I'm also the past president of the Missoula County United Way. I don't want to get in trouble for leaving anybody out. But the Our Missoula project is kind of fun because Missoula has for several years recognized the need to be intentional about equity in housing and recognizing the shortcomings of our code and what that means for, again, everybody across the spectrum. The guy building one house to the organization such as Homeward, which is a good partner in our community building permanently affordable housing. And as a community, we set out to make changes. So Missoula has for several years recognized we need to do this project, and we've been doing this project for now about 2 years. And we're on track to actually adopt new codes in the spring. At the same time, housing has been a major conversation across the Rocky Mountain West. Housing prices in the West skyrocketed more in this region than any other region across the country. And we're definitely feeling that. So the state legislature in Montana meets once every 2 years for 90 days. There's pros and cons to that. But one of their big tasks, the last session, which was last year, was housing. And so while Missoula was already kind of undergoing this code reform process, the state legislature said we need to change some of the rules around housing across Montana. And so I'll touch on that a little bit. But the challenges that we face and that we're trying to solve with our code reform are, the city must deliver on its mission to promote equitable, sustainable, and quality growth and development. Notice that it doesn't specify what sector we're talking about. It's just across the board. And that the city is not adequately implementing the policies for the community's vision of growth. And what that means in really kind of nitty-gritty terms is, in previous state law, we as a community had to upgrade a growth plan, a growth policy every X number of years. And zoning has to follow that growth policy, but the City Council and the City of Missoula has failed to update our codes to match that growth policy. And so this is why it has to be all-encompassing right now. So we are working on this to update those codes to better align with our policies and truly to better align with the vision of the people of Missoula. So what is the Montana Land Use and Planning Act? Quite simply, I kind of touched on it. It is the governing rules at the state level and state statute that tell us how we can grow, how we develop, and what that looks like both at the subdivision level, but also some of our basic code, some of the things that tell us how we can build both apartments and housing and things like that. So There were several bills out of the state legislature that are impacting our work right now. One of them was SB 382, which is Montana's land use and planning statutes. A large group of public and private entities got together. The Montana League of Cities and Towns, the Missoula Association of, or the Montana Association of Counties, the Montana Builders Association, the Montana Realtors Association, the planners, and they had a working group for probably about 4 years, based out of our state capital, but across the state, to kind of work on ideas that they thought could go into some of these pieces of legislation to encourage housing. So in addition to kind of trying to address our outdated codes, cut some bureaucratic red tape, because every politician likes to talk about cutting red tape. Do they really or not is a question we can talk about outside if you want. But also city staff, developers, consultants, everybody's been frustrated with the slow, expensive, risky process set forth in statute. And that's true for both people trying to build subsidized housing, low-income housing, and people trying to build true market rate. One of the great things in Missoula right now is my friend and our mayor actually came from the affordable housing world. And I mentioned Homeward earlier, but she's a tremendous resource kind of in this process. And it's kind of a unique thing that, at least that I have found in Missoula, or across the country, that I have found that in Missoula we kind of have this very good relationship where we have a mayor who comes from the not-for-profit housing sector, but she works hand in hand with kind of the private industry and people trying to develop code. Since you're all journalists and you might Google us, I did run for mayor and she beat me. But Missoula, we have nonpartisan races, so the difference between her and I is about this much. Some people might call Missoula utopia. But anyway, so kind of touch a little bit more on the intent of at the state level. Streamline administrative review, take more stuff out of burdensome, long, large public hearings and put it more front-loaded so that we are having the public participate in the policy-making process, which is what Ashley has been doing so well for the last 2 years. And kind of a few other things from there. So I'm going to talk to you a little bit about the why, and then at some point I'm going to just hand it off to Ashley, and she's going to kind of finish a little bit more of the how. The rate of population growth has roughly doubled since the pandemic. Missoula's population grew by almost 1% annually from 2010 to 2020, and then it grew by almost 2% annually over the last 2 years. And again, that's true for a lot of communities across the West, but we really felt that. Because one thing that Missoula recognized is prior to the pandemic, we probably were not building enough housing units to meet the changing population. And then you double the amount of growth, and that really is something that hit. And I've got some slides that'll show you from the market side what that meant to people in Missoula and kind of how that impacts that. So the blue line is Missoula County. The orange line is the city of Missoula. We are the county seat, and it is kind of confusing because Missoula is both the city and the county. So we are facing a crisis of housing availability and affordability. More families must compete for fewer homes, which drives up rents. That's been a problem, though I think we're starting to actually see some good progress on the rental side of things. So it's exciting to kind of see if this chart took you, when the numbers come out, you will actually see a little bit of growth there or improvement at the rental vacancy rate, which is positive. And if there's a higher rental vacancy rate, that generally means that rents will come down a little bit because there's more competition. So home prices growing faster than incomes, which makes home ownership out of reach for many families. You can see the average median income kind of hovered along down here, but the median sales price just took off. And we were on some housing affordability indexes, we were already unaffordable. So this is really part of the why. And you could see why some of the groups working on this both in Missoula and in Montana are truly the strangest collaboration of political groups that you could ever think of. But they're all working on the same thing, which is fun to be a part of. Lots going on this chart here, and it looks like it cut off a little bit here, but the Housing Affordability Index basically gives a community a score of 100. So that means at the given time, a family earning the geography's median income that has standard mortgage on a median priced area home would spend 30% of their income on housing. That's kind of a goal, is 30% or less of your income on housing. And the reality is in Missoula that we have seen that go down. The dark and light green lines on the chart show values that are calculated by the National Association of Realtors. So I borrowed this chart and the next couple slides from the Missoula Organization of Realtors, who have some very good information on their website about just Missoula's housing information in general. And the pink line shows the affordability index. So you can see how Missoula has struggled, and it's only gotten worse during the pandemic. So a lower HAI means less affordability. So I'm going to show you a couple maps here to just illustrate on the broader picture kind of why it is so important that Missoula is doing this, and why we are at the City of Missoula building on the kind of collaboration that Lisa talked about, but we're trying to take that and stretch that out so it works for the whole community. The pink dots represent sales that are above that affordability threshold, and the black dots represent sales that are at or below that affordability threshold. So this is 2017, okay? 2019, it's a little bit worse. 2021 actually was okay, but the only reason why, because prices were going up, interest rates got better. So because interest rates got better, the ability for people to afford mortgages helped. But that only lasted for so long, because as you can see, by 2023, very few of our sales are actually below that affordability threshold. And that's a big problem, because homeownership, one, is a tremendous opportunity for people, and it creates ties to the community. But the reality is that for most Americans, it's the only ability to build any sort of financial security. So if people don't have the opportunity to own homes, there are a significant number of kind of trailing issues that then communities have to deal with around income inequality and all sorts of other things. So these charts kind of illustrate the why this matters. Just a real quick bit on Missoula's market. Absorption rates are basically the amount of time that it would take for the market to absorb the inventory that it has. And you can look back, this is the Great Recession, so 2010. Missoula's prices, just like most of the places across the country, really felt some major issues, and that it's I don't know if, I mean, sad might be the right word here for this. The only time Missoula has been affordable is when there was a major economic crisis across the country. And that's true for a lot of communities in the West. But as you can see, once we recovered from that, our market rate has not been in that normal kind of green stretch here since about 2017 regularly. 2019, it dipped up into there a little bit, but we have been below a healthy market, which that means it favors the sellers, which means prices continue to rise for quite some time. This just kind of illustrates a little bit more specifically. We talked about the houses that people can afford for the incomes they have, and that $59,000 kind of median income was what we were last looking at. Most of the houses that are selling in Missoula are well above that. And so those absorption rates at the price points that people can afford, which are basically $600,000 and under, are less than 2 months. And a healthy market is 3 months to 9 months of inventory. So just to kind of give you a little bit of the why on that front. And then just a little bit of current information for us. The number of sales in the kind of Missoula urban area, which isn't just the city limits, but a little bit larger, is about 656 this year, which is actually a decrease over the same point last year and a significant decrease over the last couple years. But because we are still so far behind on our housing starts, prices are continuing to go up. And so that is still very much a factor. There's 3.36 months of listed supply across all price points. So we're actually in the very edge of a healthy market right now. But as you saw on that previous chart, it's really on the more expensive homes, not the homes that people making the median income can afford. And there's only been 6 foreclosure sales in our market this year. So that tells you that we are not a market that is in any way struggling with people being in the red or being underwater, but a little bit more that we just have some realities. The demographic changes in the future, Missoula is estimated to grow by about 1.3.9 annually by 2045. So it's another 37,000 people. The 2015 growth policy underestimated housing needs in Missoula. They estimated that we would need 450 to 700 units per year. And just so you know, when I say 450 to 700 units, we're talking about all types of housing, not just for sale, not just for rent, but just 450 to 700 units. But permit data from 2016 to 2022 shows that the city permitted 671 dwelling units per year. So we actually made the goal of the growth policy, but we still have the problem. And based on current housing needs, Missoula has underproduced between 2,000 and 4,000 dwelling units. And one of the things that came from that state statute, that state legislation changes, was that now part of our process is we actually have to project what our housing needs are every year so that the community knows that, and it kind of signals to both our nonprofit housing developers, our for-profit private market housing developers, everybody, this is what the needs are. And Missoula's been doing some exciting things around that, which I'll touch on. I'm going to hand off to Ashley, but we actually just in the last 3 months, I was at a groundbreaking for a project called the Rivara Project, which is over on Scott Street, which is on the edge of town, kind of by the interstate. That's going to be the largest community land trust housing project in the state of Montana's history. And the way that we are doing that is a combination of urban renewal districts, so tax increment financing, but also we have a developer that is pairing affordable land trust housing with market rate condos in the same housing development, so that basically some of that market rate housing will subsidize some of the permanently affordable housing, with a big assist from the city of Missoula. We were the landowner, and we've given a loan and done some other stuff on that as well. So that's actually a really interesting project if anybody wanted to Google that, the Rivara Project. And happy to talk more about that, but I want to make sure Ashley has plenty of time to get through hers as well. So she is going to start talking about the how, and that's starting with the equity and land use report, and then a little bit more about how we at the city of Missoula are doing outreach to actually implement this. So there you go.
That's the capital finance stacking I was talking about.
Yeah.
Hi, everybody. Good morning. I'm Ashley. It's nice to meet everybody. I actually have a journalism degree from the University of Montana myself. We did not, I don't know if you see the sign out front, but this building was established in June 2007, which is the year that I graduated. So I just missed the mark on this beautiful new building. But it's really nice to see everybody this morning. I'm going to be focusing on a really foundational report from the Our Missoula Project, which is an equity and land use report that we released about a year and a half ago now. As Mike mentioned, this project has been happening for the last 2 years, and we should be wrapped up by spring of 2025. So it's a very long process for good reason. You know, part of that is really to give enough time to get folks involved in the project. My position was established to ensure robust community engagement with this process, because if we're going to update our community's vision for growth, we need to make sure that we're reaching all members of our community in ways that are meaningful, so that they have the information that they need to be able to engage in the process, and that we have adequate time to hear from folks as to what they're experiencing in the community as it relates to some of the data that Lisa and Mike shared. Like, it's super important to tell the story through what's happening in terms of the data, but it's also important to tell the story, as you all know, from the perspective of folks that are actually living it. And so we've given a lot of time to be able to accomplish that. And as you will see, and as you probably know from your own life, it takes a lot of time to do that. It's hard to, you know, part of my job is to help build relationships and trust with folks that we haven't necessarily had that with in the past. And I will say, from my own perspective as a person, I grew up in East Missoula, that is in the county. It's a lower income area of our community. And, as Lisa shared, there's a lot of infrastructure deficits in East Missoula, just as there are in some of the neighborhoods that we are addressing through the Equity and Land Use Report and the Our Missoula project in the city. And so hearing from folks that have experiences just like mine and others, I think was super important for this project. So just to begin, our Equity and Land Use Report really helps guide us in making changes to our land use policies and codes. It explains the many facets of equity in land use, and it establishes benchmarks to measure progress on equity issues. We focus on equity at the city because for the last at least 5, 6, 7 years, we've had a lot of focus on equity in some of our city policies, including our housing policy that was adopted in 2019, our strategic plans, the first of which, the 2020 through 2023, and our current strategic plan. We have a strategic plan where our 3 lenses that we have to consider in all the decisions we make are housing, equity, and climate. And so, kind of calibrating those and making decisions on those, it depends on the project, but we have to consider those 3 things. And then in 2021, because in addition to being a part of the Robert Wood Johnson Foundation Invest Health initiative, we've also been a part of a National League of Cities equity initiative for about a year in 2020 through 2021. And the result of that, in addition to more community building and partnerships and collaboration, was this Justice, Equity, Diversity, and Inclusion resolution that really establishes our definition of equity at the city as the full and equal access to opportunities, power, and resources so that all people achieve their full potential and thrive. So, what do we mean when we are talking about our historical context in terms of our Equity and Land Use Report? We have to acknowledge the history of this valley and of the practices that have kind of gotten us here today. So we go back to the very start. We collaborated on an introduction to our Equity and Land Use Report with the Confederated Salish and Kootenai Tribes Culture Committee. And from the beginning of human time, the area now occupied by the city of Missoula has stood at the heart of the Aboriginal territories of the Salish and Upper Kalispel nations, the 2 easternmost tribes of the Salish language family. Both tribal and oral traditions and archaeological evidence indicate a presence here and a rich and beautiful cultural heritage reaching back to the end of the last ice age and continuing to the present day. The place known in English as Missoula sits at the heart of far larger tribal territories. Across these vast areas, Salish and Kalispel people lived by a way of life based on profound relationship with and knowledge of the lands and waters, and with plants and animals that inhabit them. They were and still are harvested within a culture of respect and ceremony, ensuring their abundance for generations to come. The spread of the fur trade in the 19th century brought the first commodification of the natural world to the Northern Rockies. This commodification was part of a new Euro-American economic system that initiated the transformation of the prevailing socioeconomic way of life that the Salish and Kalispel nations had known for thousands of years. A key moment in the taking of tribal lands occurred in 1855 when U.S. officials and tribal leaders signed the Treaty of Hellgate. Under terms of the treaty, plagued by poor translation and misunderstanding, the tribe ceded title to most of their lands west of the Continental Divide, while reserving as sovereign unceded territory both the Jocko or Flathead Reservation and the Bitterroot Valley south of Lolo Creek. The tribes also reserved the right to continue hunting, fishing, gathering plants, and pasturing their animals on open and unclaimed lands in the ceded areas. Oop. This is right where we are. This is the Hellgate Canyon, and the university was built essentially right where this is sitting right now. The Salish and Kalispel people were subject to numerous injustices caused by the non-indigenous newcomers. The newcomers rationalized and executed the dispossession of tribal land based on a system of land ownership, resource extraction, and profit. This is a stark reminder that rules about how land can be used and who can use land can inflict immense harm. Any consideration of social equity in land use in Missoula must be shared by a shared understanding of the original inhabitants of the valley for millennia, their profoundly different relationship with the land, water, and wildlife, and the cultural significance of the land that remains today. We also examined discriminatory real estate practices that happened in Missoula and all throughout the country. As most of you probably know about discriminatory practices such as, redlining, where families could live or buy property. They were common across the country, but really, one example is preventing BIPOC, Black, Indigenous, and people of color families from touring houses in mostly white neighborhoods and limited their options to certain neighborhoods that were more racially or ethnically diverse, or mortgage lenders who blocked access to home loans for those families if they wanted to buy a house in mostly white neighborhoods, known as redlining. A third and more explicit example is that in some neighborhoods, property owners and developers recorded legal restrictions or covenants that directly stated that BIPOC households could not buy or live in those homes. Those are now illegal, state, locally, federally, but the impacts of those practices likely still play a part in why our neighborhoods look the way that they do today. So, in addition to the history, we also examine the current state of what our city looks like and the inequities that are perpetuated with our current misalignment of our community's vision and our code that really carries out what that vision can be. In addition to affordability, we look at segregation by neighborhood, displacement and gentrification. And like we've talked a little bit about, we held community conversations around folks' lived experiences and what was reflected in the report. So not just looking at the data and saying, well, this is the story, this is where we're at. We actually went out and talked to neighbors and residents to get their perspective and say, this is what we found, what's coming up for you? A really innovative partnership that we began at the beginning of this project is in partnership on engagement with a broad-based community organizing collective called Common Good Missoula. And they helped us kick off our project with, they represent, or part of their membership is 24 different organizations throughout the community that encompass labor unions, churches, health centers like our Partnership Health Center, All Nations Health Center, the City County Health Department, and others that really either represent or work on behalf of a lot of the communities that we don't typically hear from and that we need to help build trust and a bridge with so that we have that relationship with folks that are experiencing some of the things that we're finding are happening in our community. And so that has been a really innovative project and really they helped us hold some of the community conversations around the information in this report to really get folks' experiences around it. This is sort of I would say one of the most impactful slides from the equity and land use report as it relates to affordability and our misalignment of our vision with our way to carry our vision out, which is our codes, our zoning. 64% of our land is zoned for housing that less than 30% of our community can afford. That means exclusive single dwelling or single dwelling and duplex. Mike talked about some of the legislative changes that happened in the last couple of years, and one of those is that you can now have duplexes anywhere, even in those neighborhoods that were previously zoned for single family. So that helps a little bit, but the flip side is still that only 30% of our land is zoned for what 15 to 60% of us can afford. So it's a mismatch of not only, the type of housing that we can afford, but also the housing diversity, the housing options that folks can afford. I talked a little bit about how we go through, some of the segregation, displacement, gentrification that's happened in our community. This is segregation by income in our neighborhoods. And so Lisa kind of talked about some of the neighborhoods that are lower income and the Invest Health neighborhoods. Those are pretty segregated by income. So the pink or the dark purple represents the areas where folks make less than $50,000 in our community. This, I'm gonna try and do this, but This right here is going to be our Franklin to the Fort neighborhood and River Road neighborhoods, and then up in this area is the north side, west side, if you remember that sidewalk infrastructure deficit map that she showed. Similarly, by race and ethnicity, segregated by race and ethnicity as well. Also by economic and educational opportunity. Another way of looking at it is, So that's one other way of looking at the segregation, but the takeaway is really that when compared to our underlining zoning districts, we start to see that exclusive single dwelling zones tend to have higher income levels, less diversity, and higher access to opportunity. Our higher density areas tend to have lower income levels, more diversity, and lower access to opportunity. We also look at displacement and gentrification in the report. So displacement is when a household is forced to move due to rising rents or prices. Gentrification is when rising rents or prices result from an influx of higher income households, which also changes the makeup of the neighborhood. This is, again, just a demonstration of some of the areas in our city that are have risk of being gentrified. So yellow is currently affordable and vulnerable. The orange areas are in early gentrification, so areas with high rates of residents vulnerable to displacement that are not experiencing demographic change but have a hot housing market. So the purpose is really to help us consider how to design zoning reforms so they don't accelerate displacement and gentrification. These are the key takeaways from our equity and land use report. And what I really want to elevate, obviously we've seen that our historical context is essential and we have to carry that forward into any land use plan that we have in the future. And that we have to sort of create interventions to help some of these inequities that are being perpetuated within our community. Implementing our growth policy map that we have now is a positive step, but it is not enough to address the equity issues that we have. The 6 principles for code reform that we have here are really, mainly to distribute opportunities for housing throughout the city, and design reforms to increase access to opportunity, services, and amenities, among others. And I just want to elevate that we also, through our project, came out with a code diagnostic, which really talks about our guiding principles for reforming our code, for doing something about this. And one of the key ways that we can do that is to allow for more diverse housing choices and neighborhood serving uses throughout Missoula that support our updated future land use map. That's something we've heard a lot through our community engagement and from the folks that actually are living in our community, that they would like some more housing options, that affordability is a big piece of folks' lives and they just can't afford to live here. Folks are just not able to afford to live here anymore. So what have we done? Our mission at the city is really to reflect the needs and values of our residents. It begins with that statement, and then the rest is important, but from my perspective, I think it's like reflect the needs and values of our residents. Great. At our department, that applies to our planning and development. And so promoting equitable growth and a resilient, sustainable community through the creation of innovative policies and codes and planning so that we can reflect the needs and wants and values of our residents. Our community engagement philosophy is to promote opportunities for folks to be able to actually do that. We want our approach to really focus on collaborative education. So that means when I go out and I'm having meetings or stakeholder events with folks, that I'm learning from people as much as they're learning from us. And that this hopefully is the beginning to a two-way conversation that isn't just predicated on the city needs your voice. We're going to come to you when that happens, and then we'll see you next time. Like, hopefully I know folks in the community, or we have a relationship with folks in the community and organizations in the community that can transcend what we need and actually starts to take into account what residents and organizations need as well. So sharing experiences. So that's really been a huge piece of the project for our Missoula. Like I said, it's not just about us providing data and providing education, which, I mean, it is very important to have that foundational education about what we're even trying to do. Why does it matter to my life? Why would a land use plan matter to my life? Something called a growth policy and code reform project sounds boring to me, and I work on the thing, and you have to make sure that it actually, what we're presenting and the way that we present it is meaningful to folks' lives so that they understand why it matters, so that they're not just coming and watching a slideshow and then, you know, going on with their life. That at the offset, it's, okay, we want to hear from you, and then the next time we present to you, you know what you shared last time was actually that the input you shared was put into the project in a meaningful way, that you know what the decision space is, that you understand, you know, how this affects your life and what we can actually do about it at the city. There's some things we can do, there's some things we can't do. It's our job to make sure that you understand that so that we're not over-promising. And the other, you know, I think it's just really building awareness of key issues. We are working through this project to establish a baseline for community engagement at the city for our projects based on continuous ongoing engagement. So since we've begun the project 2 years ago, we've held 3 and going into our 4th phase of engagement, where we talk to folks about why, you know, at the beginning it was just, why does this project matter? And we held a community kickoff where 250 residents attended. It was in partnership with that broad-based community organizing collective, Common Good Missoula, and we told stories from the perspective of residents. Actually, we didn't tell the stories, the residents told their stories. So folks got up and they were like, yeah, I can't afford my rent, or I use a wheelchair and there's nowhere for me to rent that is accessible, or I would like things to be more connected in my community, like Lisa was saying, not just sidewalks, but how about a bike lane? How about some better, you know, transit options? I can't afford to live in my apartment anymore. How can you help me? The second phase was really around the equity and land use report information, where we heard from over 900 residents at almost 50 different opportunities for people to give us feedback and tell us their stories, which included, you know, a bunch of different ways to engage. So this is our community kickoff, the 250 person community kickoff, which was almost 2 years ago. The top is a project, or I guess a series that we have at the city called City Chats in the Parks, where a bunch of programs or departments at the city just table at the park. We say that we're going to be there and you can come and talk to us. We focused on the first year on our Invest Health neighborhoods and did events within those neighborhoods to try and capture the voice of folks that we don't typically hear from in a way that was really hyper-local. So we're not always asking folks to come to us, we're actually trying to go to them as well. The bottom right is one of those community conversations that we held around the equity and land use report, where it was really just presenting the information and then hearing folks' lived experiences. What's this bringing up for you? Do you know somebody who's been displaced because of their rent or their housing situation? Do you know anybody who has to live in a certain place because X? So in addition to those, it's, you know, targeted stakeholder meetings with groups like, you know, people that have disabilities or aging adults or the LGBTQ community. We held one of the community conversations with All Nations Health Center through the partnership that we have with Common Good. And so it's building that ongoing trust, but it's also really trying to get out and get to know folks in a way that is beyond just information on a slide. So these are just some of the tips and sort of tricks that we try to use with our engagement, really clearly defining our decision space. So what does our project do and not do? Providing the information and education for folks to be able to engage meaningfully, so foundational information and how it relates to people's lives. And then again, just beginning that two-way conversation. This really goes back to that reciprocity I talked a little bit about. So what are we hearing in our project engagement that could apply to other community needs? Or is there something that people keep bringing up that we can respond to as a community or as a city that might be something that we didn't even think of yet? It's also important to know that people know a lot. Just because you're not a land use planner doesn't mean you don't know how some of these policies and regulations affect your life. You know what your experience is. People know what their experience is in their day-to-day life. Just because they're not a planner or they don't work at the city or they don't have that power doesn't mean they don't know what we're talking about. So we have to assume that people know a lot because they do. We are just getting started with this work. It takes a lot of time. It's just the beginning. There is no checklist. There is no end point. It changes every day. My job requires me to show up and just have, an open mind about what I might hear. I might have a really good relationship with folks one day, and then something might happen, and the next day I have to keep building it. It takes a lot of humility. It takes a lot of time. But having an open mind and being willing to learn, I think, is a huge, huge piece of this work, because change moves at the speed of trust. I can't do the work that I do, and we can't do our work at the city as effectively as we could if folks don't trust us, and we can't force that process.
Ashley, I'm just going to jump in here.
You want to cut me off, Rachel?
Well, because I think there are questions here, but I love what you just said about change moves at the speed of trust.
Yeah.
And I think each and every one of you, again, will be able to go back to your newsrooms or your communities and be able to identify the neighborhoods where this issue comes into play.
Yeah.
Whether people trust their politicians, their officials, et cetera, or not. Can we get a quick show of hands of how many questions there are? Okay, there are quite a few.
So I'm going to wrap it up. So the other thing is just to provide a ton of opportunities. Like, we're bringing out our land use plan. We have a draft and it's coming out this week, and we're starting engagement on Tuesday. It's super exciting. It's something to celebrate, but we can't just, okay, we have it. There's one chance to come learn about it. Hope you can make it from 5 to 7 on Tuesday. Like, that's not how this works. So we have 5 opportunities and online, and people can still make meetings with me to talk about it. We have some example story ideas for you that if you want to, take pictures of the next 2 slides to kind of capture some of the stuff that we've talked about. I tried to go fast. I'm sorry, we took almost the entire time.
So.
You already got the slides? Yeah. Okay. Great. This is us.
Thank you.
I'll pause for questions.
Let's start so we can get some questions in. Who wants to go first? We only have the one mic? Okay. Okay.
Hi, thanks so much.
Thanks.
My name's Eliza Relman. I'm at Business Insider in New York, and I mostly
Speak up.
report on housing and transportation issues. So my question is, obviously restrictive zoning is a huge obstacle to building more housing in Missoula. What are the next sort of obstacles after that? Like, do you need more funding for affordable housing? What programs are you going to rely on? What are the next obstacles?
The answer to all that is yes. Obviously, zoning is a huge part, but zoning alone isn't going to solve it. It's not just one thing. We can't just say, get out of the way, the market's going to take care of that, because time and time again, we've seen that it's got to be all the above. We have to pair, responsible, affordable housing, permanently affordable with market rate. But honestly, the biggest issue, and we've known about it for a while, but communities kind of ignore it, is NIMBYism. People believe strongly that housing policies should change so that more people can be housed, but not right next to them. Mm-hmm. And that's one of the biggest things that, honestly, if you were to maybe ask Ashley and I what our biggest fear of the adoption of this code reform process is, it's that, does it change so much that it scares people? Mm-hmm. So how do we present it in a way, and how do we deliver it in a way that kind of illustrates, one, this isn't terrifying. Nothing's going to change right next to you tomorrow, where it's like you live in a single family neighborhood and there's going to be like an 8-plex right next to you. But also, why does this matter? And that's why I think it's so important that we kind of try and tell the story across the whole spectrum.
Yeah, I would also say that's very true. And one of the things that I didn't anticipate through some of the community conversations that we held, and that, that our vision is really around having these collaborative educational experiences, is that when you do that, it's not just us learning from folks and folks learning from us. Folks are learning from each other. So it's harder to kind of not care about a person's lived experience when you're sitting at a table with them and you're like, I'm really afraid of the change that's happening in Missoula. But then somebody says, well, sorry, but I can't afford my rent, and I grew up here and I want to be able to stay here, and I only make $15 an hour and I'm being displaced. And it's like, oh wow, I actually, that has been a really powerful piece of the engagement work too. That we've experienced too.
Yeah, and for better or worse, and you all as reporters probably know this, but things have more impact for people if they can relate to it themselves.
Yep.
And the reality of the influx of people moving post-pandemic into Montana is that the people feeling the crunch of affordability, it isn't just where people might deem, subsidized housing or permanently affordable housing. A lot of the neighborhoods that Ashley showed in her slide, the people living in those pink dots in the middle of town, not one of them could afford to buy the house if that's their income today. And I live in that neighborhood. So I mean, this is real. And I think that it's made it more relatable as people think about their kids being able to live here, being near their grandkids, things like that. So trying to find ways to make sure people understand that it's not just, we want more housing for a bigger tax base. It has really very little to do with that. It's, we want people to be able to afford to live here.
Hi, my name is Bria Overs. I'm a business reporter at the Baltimore Banner. I got maybe two comments and then my question. One is that I found out that we have Invest Health in Dundalk, Maryland, which is like in Baltimore, which is very cool. So I'll be looking into that a bit more. And then the other thing was, I'd love to know how you all calculate like impending gentrification. Like what's this, maybe how can we all take that and calculate that in our own neighborhoods as they're changing? But maybe that's something we can discuss afterwards. But my questions are like, what's driving population growth? I feel like I've heard this in the last 2 days that like our population is growing, but I don't know why. And I'd love to know why. And then I'd also love to know, like, we're talking about community engagement within all of this, but I'm curious about what role journalism has played in this community engagement. I think that will help us as journalists understand how do we, I don't want to say help communicate this because I don't think it's necessarily our job to help, but like, we want people to also know what's going on and what's being pushed and what's kind of what these departments are up to. So I'm curious about, journalism's role within it.
I agree with you that it's not journalists' job to help me get my message out, but I think that it's to help tell the story of the community. And so I think that if we can find ways to connect. And I think this is where Ashley's work has done a good job of kind of trying to draw those, like, this is why it matters to the people who read what you write or who, follow your news stories, and how it's going to impact them in the big picture. I think that really just across the country right now, we have a lack of people who want to take the time to understand why details matter and why being part of the policy discussion matters. So I think that's where you can help, is just telling the story of your community and why communities that are looking at these things right now are doing it.
Yeah, I think that's true. And then we have we are really lucky in Missoula to have a lot of very engaged folks that want to be a part of this process and want to see certain things come out of it. And so there's, a couple of different organizing collectives that have come out of this project. I mean, Common Good has been part of it since the beginning, but Lisa mentioned Pro Housing Missoula as a kind of just collective that came together based on what we've been trying to accomplish with the project and some of the research they were doing on their own. We have like residents doing research about land use in Missoula and bringing it to the city to show us what other communities have done. And a journalist actually covered their efforts, came to they did a series of engagement efforts over the summer that Lisa touched on, but we're really around the outcomes that they want to see. And so we have to be careful as the city, I can't advocate for one thing or another. I can be there and make space and listen to what folks are doing. And so we were part of those events in that way, just to provide information about our process. But then they went on a walking tour and just kind of went through, some of the things that they want to see in the community. And a reporter followed them on the walking tour and wrote about their efforts and also the project itself. And so that's kind of a unique thing that we have in Missoula, is very robustly engaged community. Like, my job is not as hard as I make. I mean, I think there is a lot that has to be done in terms of building trust and building relationships and making up for past harm, for sure. But as it relates to getting people involved in, especially this project, we've had an overabundance of residents that have done that. And that might not be the case in your community, but I think that looking at some of the stakeholders that are impacted by a project, and then looking at who's at the events or talking to the cities or municipalities about who's represented in their processes, and then going out and looking for who's missing and saying, hey, do you know about this project? Or, this is something that really affects your life, and trying to help tell that story from a resident perspective. I mean, it's really, it wasn't hard to find people who were affected by the fact that our growth policy and our code are out of alignment, or that the housing crisis in Missoula and Montana and the Mountain West is real. Like, you just walk out, and even folks that I work with, I mean, it's not hard to find folks. But I think one of the things that I've at least tried to do through the engagement effort, and will continue to do, is just looking around and seeing who's a part of the process, and then looking at who's missing, and continuing to try and reach that voice, I think, is really important.
Actually, it's dropping gems right and left here. It's about storytelling.
Yeah, for sure.
And so, as you pointed out, maybe it's not our job to help or whatever, but it is our job to find stories and have people communicate how these issues are affecting them. We've actually reached the end of our time, but I'm going to make an executive decision because there are two more quick ones. I hope they're quick. Stephanie and Brittany. But you'll have access to these folks while you're in town, and I encourage you to reach out to all of them. So let's quickly, Stephanie, let's take yours. Introduce yourself.
Yeah, I'm Stephanie Stokes. I work with the NPR station in Atlanta, and Atlanta has a lot of challenges making big changes because of the state has different political views, and they often, like a lot of states, have preemption laws that prevent the city from doing things. And I was just curious if Missoula, if you have that same sort of challenges with the state and how you navigate that.
A lot. Yes. I'm an elected official, so I can answer it however I want. That would be nicer. Yeah, we do. And I'll be honest, sometimes preemption in certain situations isn't a bad thing because it sets a standard of consistency across the state and it pushes back on some of these unfair practices and NIMBYism. But then there's a lot of times where, Montana's a state with a few urban communities, and I mean, with where some of you come from, we're all really small. But and then a whole lot of communities that are very small, but the state legislature is dominated by those communities. So it's sometimes hard to explain. These are issues that impact us in these like 6 or 7 locations across this vast state, and getting people to understand the why is difficult. And yeah, I could go on and on, but that.
Hi, so my name is Brittany McGee. I am out of Columbus, Georgia with the Ledger Inquirer, and Columbus is also dealing with a lot of historical racial segregation in the city. There's a community reinvestment department that is, working on those issues. And the fact that you guys use CBDG funding just kind of stuck out to me because that is something the community reinvestment department in my city has been doing a lot of work with. So I was just curious, how important is that government program going to be, for your initiative going forward? And just a little bit about like what your experiences were working with it, because it seems to be a big thing that Columbus is working with. So I just kind of was wondering if that was similar with another, mid-sized city.
Yeah, I don't unfortunately know as much about CDBG as I should, it just doesn't necessarily, I'm working really specifically on the Our Missoula project, but I do know that it's very important to a lot of the efforts that we have in the community. We just did a presentation to council, what month is it? Okay, so in the last couple of months probably, that is on our website, and it was all about the different projects that receive that funding and how we utilize it in our community. We also locally have what's called our Affordable Housing Trust Fund, and it's a local $100,000 minimum investment every year through our city budget that can help address affordable housing issues in the community through either innovative partnerships with some of our community partners or help with like homeward classes for homeownership, for example. Folks have to apply, or organizations have to apply to receive the funding to carry out some of those goals, but it's definitely super important, and I know we have an Engage Missoula page about specifically those projects. You might have more information too.
Yeah, I mean, the short answer is it's huge, and it's huge for us, just like it's huge for your community.
Yeah.
And one of the realities is, as a nation, we just have oversimplified so many of our challenges. But there are things that local communities themselves can solve. There are things that state and local governments together can solve, and there are things that take every level of government to solve. And no community is going to take steps towards making housing more affordable, housing more equitable without programs like that. And we would be sunk if we weren't, good at that. And I really think that the little exposure I have to seeing how other communities do what we do across the state and across the region is that the communities that take the time and invest in the staff to understand how to take advantage of those programs and make sure that everything that we need to do, every box we need to check to be eligible, we do, have better success rates, have better end outcomes. And so it's hugely important. And I could probably go on and on and on, even though I'm not an expert either. Never trust an elected official about these things. But it's true. I mean, it is a major piece of what drives our success.
This has been an incredibly thought-provoking session for me. I think when it comes to someone like you, Lisa, with your strong background in organizing and community work, I would love to pursue more with you about how you made that transition to the public field. And we will get to do that at some point. But the thing I want you all to take back again to your communities is it possible in my locale for this kind of collaboration and this kind of energy to even occur? Is this something that is only possible in mid-sized cities? Could Chicago ever do something like this?
It's I just want to say, looking at your agenda, Rachel did a beautiful job of lining up all these panels for you. And those are our community partners. Those are our collaborators. And some questions that might be stewing in your head might be answered on the housing panel next. It might be answered tomorrow with Regime from Empower Montana and Heidi about how to engage on racial equity in our community. So I'm really excited for you to see our ecosystem of Missoula Invest Health and with the city of Missoula and our county. This is all a collaborative project, and we couldn't do it without each other. It's like a tapestry, a woven tapestry. And we communicate a lot, and I think you all can do it in your cities, no matter how big or small you are, and it just takes one ripple to take it out. And I know in Baltimore, you have an amazing initiative for the Invest Health there. But you can start with your public health department, and I'm happy to have conversations and share more materials after today. I'm always available. So.
And with that, let us show Lisa Betskowitz and Mike Nugent and Ashley Brittner-Wells our appreciation for joining us today. Thank you so much.